Hello, I'm Dr. John Tomasoff. I'm here with Dr. George Chapman.
How you doing, John?
Good. And Dr. Chapman is probably one of the leading pioneers in thermography today. And it's always a privilege to be with him and discuss some of the history and some of the things that we can find out and learn from thermography. Today we're going to do a series on what is approved, what we can actually see on thermography, and really what we can't see on thermography. So let's get started. In 1972, the Department of Health, Education, and Welfare declared in a paper by the director Thomas Tierney that thermography was beyond the experimental in the following areas. And one of them, which is probably, we do about 90% of, is evaluation of the female breast. The next one is vascular analysis and extracranial analysis, and then musculoskeletal analysis. Now, Dr. Chapman, here we have the evaluation of the female breast. Go ahead and discuss this.
What we have on this is cancer actually in the upper right-hand side of the breast, and we're pointing to it right here. The left breast is cancer-free. It's one of the areas that thermography is extremely effective, and actually thermography is probably the best definitive avenue for breast cancer. We pick it up about 5 years before a mammogram, and about 7 to 8 years before an ultrasound. And with MRIs being 38% false positive and thermograms being 97% accurate, according to Purdue University, then the thermogram is very, very clear, and you can see the cancer is just wonderfully displayed. This particular view had a negative mammogram, negative ultrasound, negative CAT scan, but the thermogram is clearly positive here.
Thank you. And the next one we talked about is vascular analysis. This one kind of goes unrecognized a lot of times. With I have patients come up to me, well, can you tell if I have a vascular headache or a vascular problem? And some of the benefits of doing a vascular study versus the standard study that we see.
Right. This particular patient has lymphedema, and that's what the mottled pattern looks like on both sides. And the vascular analysis can be done on a thermogram quite effectively, quite accurately, and is also much less expensive than an arteriogram. An arteriogram is also somewhat dangerous. Thermography is not dangerous at all, and you can utilize the thermogram to monitor changes in the vascular patterns that we may use.
So in our second series, what we're going to be going on is further the approval of the FDA, HEW, and the other studies that thermography is also beneficial for.
That's right.